So good afternoon. I want to start off with first recognizing or acknowledging this is National Indigenous Peoples Day and join others in celebrating the heritage, diverse cultures and achievements of First Nations, Inuit and Métis people. As some of you may or may not know, I started as a medical student going up and having the privilege of working in the Sioux Lookout Zone area and working with a number of First Nations. Went back as a intern, then as a staff member for over nearly 3 years. And at that time, I really valued the opportunity to work with many different communities and to benefit from the time there. We used to have a saying that when we went up, sometimes you knew the answers to all the problems in the first few weeks. If you stayed long enough, 6 months, you realized you only had answers to half the problems. And if you stayed more up to a year, you realized you really didn't have answers to any of the problems. But you knew that working with the wonderful people and the various rich community members, that you learned a lot and could understand and can work alongside with them as they dealt to deal with their problems, and you had that benefit and that opportunity. So I really like to recognize this as National Indigenous Peoples Day. I'm also pleased to be joined again today from the Vaccine Distribution Task Force, more as I call him as the Chief Coroner. Dr. Dirk Huyer has filled in many roles for us in this last while, and this is my last press conference together with him that I know of. Just for people who don't know that before COVID, we did press conferences together as well on a number of issues. And so we have done that and support each other throughout this time. And I've really enjoyed the privilege of working with Dr. Huyer throughout this time and having weathered this issue through the months and year and a half that it's gone on. It makes a bond that we won't be forgetting anytime too soon. So thank you for your part. And I know that he'll be working along with Dr. Moore, who is succeeding me on Friday, and I really encourage him to work with that. I know they know each other, and so it'll be another strong partnership as we move forward. So it's Monday. So we look back, what happened over the weekend? Where are we at this time as we're venturing through step one and see how we're doing, how we're progressing in this process with vaccination and cases and case contact management. So Ontario reported since last Thursday 1,288 cases of COVID-19. If we break that down and you watch the flow of the numbers here, we did 345 cases reported positive on Friday. Then we went up to 355 cases reported on Saturday. We dropped back down to 318 cases on Sunday. And today, we reported 270 cases. So that means this is the lowest count we've seen in a day since September 15th, way back then, when Ontario reported 251 daily cases. Back then, we didn't have a vaccine, and we were waiting eagerly for its development to come to fruition. So Ontario's 7-day average continues a steady decline and is currently 334. That's down from 503 1 week ago. That's how abruptly it's coming down and shows you how effective our vaccination program is and will be. Hospitalizations in ICU. Let's look at that. And we've seen an improvement in the number of hospitalizations. Talking to our Ontario health people, they see those numbers of admissions coming through, which is a better measurement of what's happening than in our ICU, which we've noticed some are staying longer and longer because of the younger age group. They have much better endurance during this time of, in a way, fighting for their lives in the intensive care units. Today, there are 261 people in hospital. And this is a bit underreported because not all the hospitals are reporting. So we're trying to look at how to get that as current as possible. The number of Ontarians in ICU, because we've taken out the Manitoba clients, 13 at the moment, is down to 309. So we're close this week to dropping below 300. We've been wanting to that since the outset of this third wave. And another success of the effects of the vaccine and what we're doing with our public health measures to keep things under control as our healthcare system recovers. And more of those ICU patients now will become ones of elective surgery or urgent needs and issues that did not abate during, especially the urgent care cases during the COVID, and that was pressuring our system. So we're glad to have that and a break for our hospital staff as they face the challenges of the work ahead. Sadly, we saw another 29 deaths since Thursday's update. This includes 3 COVID-related deaths today. While this number's down, it doesn't give us much solace because we still would like to express sympathies to the families and friends who have lost these loved ones during this time and during these difficult times in there. But we take some solace that the numbers have decreased. We'd like them down even lower. And we'd like them gone if we could. Testing. The testing has remained robust over the end of last week, but as usual drops down on the weekend. And so we did 13,828 tests processed yesterday, part of the weekend dip that we often see. And the positivity rate, as usual, climbs up at this time, but this time we didn't climb over 3%, we stayed below at 2.5%. Our positivity rates continue to decline, since the current 7-day average is now 1.7%. That's down from 2.3% 1 week ago. Again, another indication of the impacts of our vaccination program. The vaccine program, it's going really well, and it's one of the best performers, even on a global perspective. To date, more than 12.6 million doses of COVID-19 vaccine have been administered, and close to 3 million Ontarians have received both doses. These are tremendous numbers, and every person vaccinated makes us all a little safer. As a reminder, beginning today, all Ontarians who receive their first dose of an mRNA COVID-19 vaccine on or before May 9th, 2021, are eligible now to book their second dose appointment. And this coming Wednesday, individuals will receive their first dose of an mRNA vaccine on or before May 30th and will live in one of the 10 public health units identified as Delta hotspots. The Delta variant is circulating and is becoming more dominant all the time. Smaller numbers at the moment, fortunately, due to smaller tests. Nevertheless, it's out there, it's widespread, and we're concerned that it be kept under control. And so these people in those 10 areas, as of next week, Wednesday, will be able to book their second dose appointment and to check your booking system for that. I encourage everyone to get their first dose of COVID vaccine as soon as possible. We still have some who have not done that. We are trying to get to that 80% mark. And as we said before, the Delta variant has much dire consequences on unvaccinated people, much more than the so-called UKB 1.1.71 that we were dealing with mostly in wave 3. And this one is still around, and we're concerned that if you're there, you're quite susceptible, and you need to take these steps if you've been hesitant or not sure. Consult with your primary care provider, and most important, go out and get your vaccine, because you will not be turned away, as we want you vaccinated as a priority even before second dose in that sense. If you do come forward, we want to get you protected. If you have experienced any challenge in booking, please be patient and keep trying. Those who had difficulty earlier last week have found they got their appointments and working through the different systems, whether it's through the pharmacy system, through the COVAX system, or sometimes with separate systems in the health unit. Go through that process, get your booking, and make sure if you have to rectify any things with previous bookings to do so, or ask how to do so if it's not in the same COVAX system. We have a large volume vaccine coming. We heard some more announcements. We may get even more in certain types. So it's not that we're going to run out. So if you haven't got your appointment yet, you will get your second dose. And to wait on there. Individuals who receive Pfizer for the first dose are offered now Moderna as a second dose. So don't feel hesitant in receiving this to get your full vaccination status. We would ask that you not reschedule any appointments to try and get a second dose of Pfizer at or a later date, as we have a large supply of Moderna coming right now. So some are saying, how long might, could, or should I wait? And the thing is that we are saying that if you have an opportunity, that you may proceed to go ahead and use Moderna as your second dose as compared to Pfizer, because we want you getting the full protection as soon as possible. So mixing vaccines, as we've heard from our National Advisory Committee on Immunization and other centers, is effective and safe and enables Ontarians to receive their dose sooner, if that is the preference of the person seeking their vaccination. If you had Moderna or Pfizer for your first dose, you can safely receive either Moderna or Pfizer for your second dose. Both Moderna and Pfizer vaccines are authorized for use in Canada and use a similar mRNA technology, so the vaccines are safe to mix. One of the key strategies to slow transmission and to keep the Delta variant under control and avoid a fourth wave is to get vaccinated as soon as possible. First dose to protect you from severe consequences and hospitalization, but that doesn't interrupt transmission. Second dose does interrupt the transmission and reduce any symptoms at all, and especially with the mRNA vaccines, has a very high level of performance. So, what does that leave us? Overall, the trends in Ontario continue to head in the right direction. We're following the course. We're staying on line with what we were predicting would be, and that's excellent. We cannot let the steady decline in cases give us a false sense of security. We are still having, except for today, over 300 cases a day reported. That's with 20 to 30,000 people coming forward getting tested. We still have some hot zones that are now just starting to come under control. These are not all located in the GTA. They're out and around other areas where you may not have experienced much as far as presence of other things in the past 2 or 3 months, but that's an area that is certainly naive for the Delta virus and can erupt very quickly if it does so with an unvaccinated or under-vaccinated population. So we still need to be vigilant. We still need to pay attention and to use our public health measures until we make sure we have enough coverage across the board. So adhere to the public health guidelines. I've noticed that a lot of people are doing more and more of the outdoor activities. It's been great to see, and people anticipating more in the future. And we just want to make sure we pace it at the right time, so we do not want to invite any part of a fourth wave. We've had a couple of places that jumped up. Even in our area of Porcupine is settling down at this moment. Our James Bay coast area seems to be settling down at this time. We're still watching carefully, as well as some of the areas in the Waterloo-Kitchener area is also settling down to some extent, and we want to watch that. So we're remaining steadfast and making sure our public health measures are working as we get the vaccine rollout continuing, and as we get those second dose numbers up, as well as trying to push towards that 80% first dose coverage and making great headway on our youth vaccination, namely the 12 to 17-year-olds. So all going in the right way, and it's really reassuring to me to see all this happening as we may see a good sense of direction, staying the course, and making sure that we get Ontario past the pandemic into a different phase there. But that all means we continue to do what we're doing, do it again, do it well, and do it consistently, because we are getting there. That's a credit to all of you. You are doing your part upon the measures, your part on getting out and getting vaccinated, and your part in getting your second dose of vaccine. So with that, I'm going to turn over the media question. Does Dr. Huyer has any comments to make?
I'll just make a couple of quick comments, if I may. First off, just thanks, Dr. Williams, for your kind comments, and just recognize the honor that it's been to stand beside you and work with you throughout the past number of months, and frankly over the number of years. So thank you so much for that opportunity. Just to frame a little bit, as most people know, I'll usually come as the complete optimistic with the 76% of everybody receiving the first dose. But to amplify a little bit what Dr. Williams is talking about, unfortunately, that does mean there's 1 in 4 people who haven't got their first dose. And it's so important to protect those people and provide that opportunity to those people to encourage, make available, obtain the opportunity and avail themselves of that opportunity to protect themselves from serious illness and hospitalization. And then the second dose, again, to prevent that transmission. So really a strong thing to think about, and recognizing that we have so much Moderna vaccine coming right now, a little bit delay in the Pfizer coming by 2 to 3 days, and recognizing that so many people got first doses of Pfizer. Now, as we move so quickly in that second dose, really want to provide that opportunity to go as quickly as possible with each of the mRNA vaccines to provide that substantial protection for everybody from this horrible virus. So I'll pass over to Alex.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
Randy Rath, CHCH.
Yeah, hi, doctors. Thanks for taking my questions. I'm wondering, this CDC in the States is looking at possibility of. I'm sorry, I've got feedback on this. If the audio guys could fix that for me. Okay, thank you. I'm wondering, this CDC in the States is looking at giving people another dose, a booster shot in the fall. Is that something that you think we're going to have to do here?
Well, I think it's a good question. We're trying to watch as we start off very quickly doing second dose on our most vulnerable populations to see what's the longevity of the protection in the group there, especially a group that has less than robust immune systems that a lot of younger people have. And so far we've been feeling reassured by this at this time. Booster dose is necessary for two reasons. One is that if you feel there is a dropping of the immune level or waning, as we use the term, we'd like to see evidence of that and to see what basis CDC would make that recommendation, as well as the manufacturers. In there, our federal people are reviewing the matter, as well as our National Advisory Committee on Immunization. We have received no recommendations yet on that matter. The other time they may want to do some booster that is not talked about so much, and one of the advantages of the mRNA technology is that if there was a new variant or strain that was not covered as adequately under the current one, they can modify that and use that in another way. That we have not heard of because thus far all our vaccines have a good response to all the variants we've seen, variants of concern, and that's reassuring. So I would say while CDC is musing over that possibility, we are also with our experts looking at it in conversation with the manufacturers and with our international partners as we seek to look at it on a go-forward basis. But right now we have nothing definitive to offer on that at the moment, but it doesn't mean we won't be looking at the question, assessing the question, and ascertain if that is really necessary, and we'll do so if and when that is deemed to be the case.
Follow up?
Yeah, okay, and we're also hearing from various parts of the healthcare community that because the hospital system has basically been shut down for the last year and a half, that we're going to have a crisis in cancer care this fall. Do you have any way to quantify how bad that crisis is going to be? And are there any other parts of the healthcare system that are going to see the same fate?
I wouldn't say the same fate all the way through. One of our concerns is as we go through this issue, especially when we, in the past, I had to give a directive to hold back on elective surgery for in-hospital to allocate staff to cover what we were worried about was a major surge, and it did get large, but we didn't exceed what was deemed to be a situation where we had to use a triage system, and we've come back from that. Already, all those staff are being reallocated back in, and they're starting to do more and more procedures and diagnostic workup. Ontario Health has been cognizant of this all along, as well as with the different hospital administrations and that as they seek to bring back. And some have been doing some work on elective surgery fairly extensively already. I think as far as the cancer one is there, is that one we've been really watching to see, have they been assertive in making sure any urgent or desired one, they still went forward during the COVID, even elective surgery cancellation. All the urgent procedures were not curtailed because those are what physicians had to make decisions on. And they would do that on a priority basis. At the same time, we know there's a backlog of procedures and diagnostic and workups, and that's why we need these ICU numbers down. Not just down to 300. We'd like them even lower because the lower they go, the more beds there are available, because some of those elective procedures, semi-elective procedures, do require a stay in ICU, and we need to make those extra beds and resources, even the ones we've added to the capacity of the system, to step up to that. And that's one of the benefits of having increased our ICU capacity. Means we have more capacity to take on this load of the elective procedures that are waiting. And again, if there's any impacts on criticality in surgery and that, we leave that to Ontario Health, as well as with the various teams of the physicians out there who have all along been assessing and making sure they try to bring as much forward as quickly as they can, knowing that this is a load on the hospitals, but it's one that we're hoping that with the relief, and that's why we're so assertive of wanting these cases down, we do not need this to resurge back up again. And so that's the point you're raising, Randy, is one of the reasons why we want this down to stay down, so they can continue to really work assertively at catching up with any of these semi-elective and getting back to the totally elective, and to get things back to as close as we can to that. But it will take some time, and we leave it to their discretion to understand which ones are not elective anymore, are essential and critical as they have done all along.
Next question.
Camille Karamali with Global News.
Hi there. Thanks for taking my question. My first question is we had a reporter, actually a couple of reporters, already meet a number of people who walked away from their appointments today because the clinic they went to had switched from offering Pfizer to Moderna for their second doses. So what do you say to Ontarians on the fence about mixing mRNAs? Are you worried about this potentially slowing down the momentum that's been gained in this rollout?
Well, thanks for that question. Our hope is no. These, both the mRNA vaccines are made with the same research and technology. They're delivered in the same way. They have the same effectiveness, generally speaking. They have the same side effects, and they have the same mechanism. So all of those things support what the National Advisory Committee on Immunization has made recommendation, and that we have taken forward in Ontario, which is to receive the first available mRNA that is provided to the person to provide them the immediate and strong protection against COVID-19 and all of the Delta as well as the other variants. So we are we believe that both vaccines provide equal or as effective protection and in a safe way. So that is why we have made that recommendation. I think it's important for people to understand that these are both made in the same way and have the same benefits when we calculate the two together.
Follow up.
Thanks for that. With all that being said, I mean, it just seems like we're still seeing anecdotally people who just want to keep with the same vaccine and are canceling appointments. So for those who do opt to back out, are you able to tell us when they're able to rebook or how or if they're able to do that? As I think I said earlier, the volume of Pfizer is a little bit less this week, delayed somewhat, and then we have a significant amount of Moderna available. So there is the opportunity for them to avail themselves of mRNA vaccine as quickly as possible. And if they have chosen not to do that, then there may be a period of time that they will have to wait before they receive their second dose. And obviously that concerns everybody because we want to provide the best protection as soon as possible.
Next question.
Lena Latifat with CP24.
Thanks so much for taking my questions. Provinces like Saskatchewan and Alberta are getting set to lift all of their restrictions. Any plans, Dr. Williams, to unveil what happens in Ontario after Step 3? And more specifically, when do you think Ontarians can ditch their masks?
Well, I think that some of the openings in those provinces are similar to our Step 3. And the public health measures table and others will be looking at what is beyond Step 3. And that's a period of time off. We're going to see with the improving vaccine coverage. What does that mean in a nearly fully vaccinated society? In there, that means you have issues related to the ones you've alluded to. In there, we're already looking at what does it mean if you're doubly vaccinated with a period of time for the vaccine to take effect, of course, about being in your personal life circle, about wearing a mask inside if you need to or not, and distancing and different aspects there. So we hope to have that information out to you soon in there. As far as society-wide rules on masking and different things that can take effect, we're looking at beyond Step 3 to see what does that mean. And of course, you have the other component that's weighing in there. It relates mostly to borders and travel and movement. And there's some aspects that, of course, the international world are looking at, as well as with our federal counterparts on what may be transpiring at that time. So there's a number of things to be brought into component here, especially in Ontario, where the amount of travel in and out far supersedes any of those seen in places like Alberta and Saskatchewan. So we have to be wary of that and how to make sure we deal with that, being especially in our GTHA, an international global station, if you may, in those realities. So we're going to be looking at a number of factors in there and hope to be advising the public in due time, well ahead, what will be reasonable and feasible. And of course, we're going to be watching our numbers and the vaccination performance.
Follow up?
We're also learning about a COVID outbreak at Toronto Western Hospital. The hospital says this is likely the Delta variant and says even people who have been vaccinated have been infected. Anything that you can tell us about this outbreak?
I know Dr. Huyer has the outbreak stuff, and he may have a few comments to follow. I think it tells you, first of all, as I said in the opening comments, we cannot take the Delta casually. It is highly transmissible. And when you see people it's transmitted to, you're going to have people who have been vaccinated partially, one dose, and we've said before that does not, well, it renders you a protection against the severity. And why they end up in the hospital, I don't know. And some find they got COVID like 2 or 3 days after the vaccine and wonder why. You do not really build up much immunity until about 10 to 12 days after the vaccination. You need really 2 to 3 weeks to build up a good amount. Younger people, shorter period. And so if there is positivity, are they very sick and ill? And so we'll look for the investigation carried out, no doubt, by the infection prevention control leads at Toronto Western Hospital and by Kevin Smith, the CEO, to undertake to ascertain what is the issue here and what has been found. I'm not sure, Dr. Huyer, if you have any further comments on this particular outbreak.
It's tough to speak specifically about the outbreak, apart from saying clearly we want to ensure that we minimize any chance of outbreaks, specifically those in populations that may be vulnerable, given that people in hospital may have other illnesses, and this is clearly something that we don't want to occur. I think just to reiterate some of the things that Dr. Williams said, we know that the first dose of all the vaccines that we have, AstraZeneca, Moderna, and Pfizer, all provide a lesser degree of protection from getting an infection, but do provide significant protection from seriousness of the illness. So I don't know specifics in the Toronto Western as to how sick people are, but clearly if there are infections, those can be spread to those who are not vaccinated. As I talked about earlier, 1 in 4 in Ontario right now do require their first dose, and we should be striving to provide everybody their first dose. And then those who do have their first dose, getting that increased level of protection to reduce the chance of transmission of the Delta variant or other variants of COVID. So again, reiterating the importance of moving forward with getting first doses in continuing to increase the number that we have vaccinated, as well as getting second doses when that opportunity is presented to you as quickly as you can when you have that chance.
Last question.
Brian Lely with the Toronto Sun.
Hello, doctors. You've been speaking about the Delta variant, and I want to put what is likely a hypothetical to you. As we look at our reopening, you are concerned about the Delta variant. In the UK, they've seen a dramatic increase in cases, but not a corresponding increase in hospitalizations, ICU admissions, deaths. So could you foresee a situation in Ontario where, especially considering that we are further ahead of them now in terms of vaccinations, especially with the one dose getting to younger people, could you foresee a situation where if we had a spike in cases but not a corresponding spike in hospitalizations and ICUs, that we wouldn't go back into lockdowns? I'm asking for all the small business owners who have been looking forward to reopening but are concerned that we'll just end up in another lockdown. Could we have a spike in cases without a lockdown if there is no corresponding increase at hospitals, et cetera?
Well, thank you for that question, and this is one we've been looking at. And you raise a good point that besides our vaccination coverage levels, we have a number of other metrics we are watching. One I'm mostly interested in is the one you're raising, is hospitalizations. And hospitalizations with no dose, hospitalizations with one dose, and hospitalizations with 2 doses. Because assume if they're getting hospitalized, it must be severe enough to have some reasons for that. And what we're hoping is what you're anticipating, that if we have a high enough coverage, as Dr. Huyer said, right now we're about 1 in 25 with first dose not being given, or 1 in 4, I should say, and that leaves a fairly large segment of the population still there. And especially when that clusters together in groups, you have a potential for a fairly significant outbreak. And we've seen that in a couple of our areas already. And then just with the previous question, know that there was an outbreak in Toronto Western Hospital and supposedly with vaccinated individuals. We need to understand that and review that before we get complacent and think we're in the clear. I'd like to be in that situation where we're in the clear. When the past with SARS, I remember when it changed and moved into being much more like a regular coronavirus, that's a cold virus, where people may have got ill, but some did not require anything beyond that. That can happen as these viruses attenuate is the word. We haven't seen that yet. The variant is still causing consequences in there. And we do want to be wary if there's any new variants of concern that are arising in the global mix and picture. There's a lot happening in many different countries and many different groups and people, and these ones can arise and be transmitted with movement. So we want to be alerted to that fact. So your point would be correct, is if we had a high vaccine coverage, and even if we had cases, no one was getting hospitalized, no one was getting sick, and it was very much just a documented like a regular cold, that would be great. We're not in that position right now, as we still had clusters and outbreaks in our numbers, and as we just discussed in the previous question, an outbreak supposedly of the Delta in hospitalized patients in one of our tertiary care centers. So we can't be overconfident yet at this time.
This is the last question.
Okay, then, what are you seeing in terms of hospitalizations now? You mentioned no dose, 1 dose, 2 dose. Are you seeing many people hospitalized with 1 or 2 doses at this point? And if I can throw in a double barrel here, can you expand on your concerns about border? You've mentioned travel a few times. The federal government keeps telling us it's not an issue. You seem to be concerned. So if you could expand on that, please.
So in our numbers we give you, we talk about our ICU numbers, but they are not, as the modelers have noted, and we've noted, they don't change as quickly because of length of stay. And so therefore they're not very much a real-time indicator of what's happening. Our hospitalizations are more of an indicator, and we noted how many hospitalizations we've received and those numbers coming down. And as we've asked for some data and see if we can get even more robust data to say of those ones being hospitalized, how many have had no doses, how many have had 1 dose, how many have had 2 doses. By far, most of the ones tend to be no doses. And there's a few with 1 dose, and some are like a few days after they got their first dose, which really means it's basically no dose as far as immune response, because they're already incubating at the time they got the vaccine, unfortunately. So it's reassuring to us in one way that vaccination, 1 dose and 2 dose are giving great protection. And by getting up to that higher number percent that Dr. Huyer's alluded to and we want to get to, will be reassuring. At the same time, we are concerned that there's still people with no vaccinations being admitted to the hospital and going to ICU and dying. And to me, that's really unfortunate because these ones, by our knowledge base, are preventable. And we are really at times perplexed that people are not coming forward. Yet it's a voluntary thing. People do what they choose to do. We're trying to give you all the best information we can. On the border issue, these variants that come in, they don't arise in Ontario, they come in and they start moving and spreading through. That's why a number of weeks back when we were detecting the so-called, we had a different name for it then, now called Delta to avoid a long list of numbers and decimal points. It was already moving in and around through. It came in from somewhere. And as I said, you're having many countries around the world where there's natural migration of the virus through populations that it modifies, it changes and shifts, and the ones that are very transmittable and maybe unfortunately causing disease start to arise. Because Ontario is quite different than some other provinces where we have such a rich multicultural and people moving back and forth who may feel there's good reasons, and as they open up the borders, may have reasons they've had to go there and come back again. As a result, while they want to bring back memories and things like that, we do not want them to bring back new viruses and variants. So it behooves us to say, how do we set up that, one, that people going are fully vaccinated and covered, and second, when they come back, what kind of monitoring in a way that's effective, efficient, representing or respecting the individuals coming in a way that they want to be careful, we want to be careful, and how do we endeavor to create that kind of, I would say, robust surveillance system on a go-forward basis to keep us in that kind of good position in the way forward. I know that Dirk probably has some concerns also, being an outbreak coordinator, and probably comment. So over to you, Dr. Huyer.
Thanks, Dr. Williams. And thanks, Brian, for those questions, very poignant ones, of course. So recognizing the Delta variant is more transmissible and does cause more significant illness. That's the fundamental facts with what we know from Delta right now. And the hospitalizations in the UK are those who generally are younger and not vaccinated. So serious illness in people. So as we move to further steps of opening, that increases the potential for transmission because there's more intersection between people, and therefore what may be smaller numbers of transmission may increase to a greater number of transmission, and we need to protect from that by reducing the potential for infection through vaccination and also ensuring that people who may have this infection don't spread it further. So that's why we're imploring people to move to getting their first doses, ensuring that they have that, and then when they have the opportunity to also vaccinate with a second dose to reduce this chance of spread, because clearly there are people who are not vaccinated who are at greater risk, and we do not want, with greater opening and greater intersection with people, to have that transmission spread to those who are not in a position to protect themselves through vaccination. So I think it reiterates many of the points that Dr. Williams made and also that you asked, Brian. So thank you for that.
Thanks, everyone.
Dr. Huyer.